What is the mechanism of action of this ciprofloxacin? So it is one of the direct questions that the mechanism of ciprofloxacin. Ciprofloxacin acts by which pathway? Here the options. Options are the inhibition of the DNA gyrase, direct injury to bacterial cell wall, osmotic damage to the cell, inhibition of reverse transcriptase, destruction of bacterial aquaportin, aquaporin protein. So what is the mechanism of action of the ciprofloxacin? So let's see different type of the mechanism of action. So as I said, you can see the inhibition of the cell wall and misleading of the mRNA, and including here we can see the inhibition of the DNA synthesis. We know the DNA is the main factory for any type of the cell, and here we can see the different type of drug which inhibits the DNA synthesis. And here we can see first of all quinolone groups. These quinolones are ciprofloxacin, moxifloxacin, ofloxacin, then metronidazole, sulfonamide, and trimethoprim. So these are the DNA synthesis inhibitor. Again, quinolones, metronidazole, sulfonamide, trimethoprim. They inhibit the DNA synthesis. Then here we can see another important one, which is the cell wall formation inhibition. And this is another important group of the drug. And here the cephalosporin is the main drug. Also the penicillin. So penicillin and cephalosporin, they inhibits the bacterial cell wall formation and ultimately the death of the bacteria. Then here we can see the aminoglycoside. This aminoglycoside, it causes misreading of the mRNA. So aminoglycoside, they are chloramphenicol, macrolide, tetracycline, fusidic acid, and rifampicin. Also they causes or they responsible for misreading of the mRNA. So what is the mechanism of action of the ciprofloxacin? And as it is a direct question, so direct answer is the inhibition of the DNA gyrase. Other options here, such as the direct injury to bacterial cell wall, it is by the penicillin and cephalosporin group. Osmotic damage of the cell wall, damage of the cell, inhibition of the reserve transcriptase, some important drug also present, and destruction of the bacterial aquaporin protein. Some drug also acts on there. So our answer is the inhibition of the DNA gyrase. It is done by the ciprofloxacin.